high blood pressure is called the silent killer because it destroys the body quietly, slowly, and without pain. Most people feel completely normal. They go to work, drive their cars, eat their meals, unaware that their blood vessels are under constant attack. According to the American Heart Association, nearly half of all adults in the United States, over 120 million people, have high blood pressure or are taking medication for it. This means that statistically, every second adult you see is affected. Even more frightening is that almost 1 out of 3 people do not even know they have it. Uncontrolled blood pressure is now the #1 preventable cause of heart attacks, strokes, kidney failure, blindness, sexual dysfunction, dementia, and sudden death. Every year in the United States alone, over 700,000 people suffer a stroke, more than 800,000 have a heart attack, and high blood pressure is a major hidden driver behind both. What makes this condition so dangerous is not how fast it kills, but how slowly it destroys. For 10, 15, even 20 years, damage accumulates silently inside your arteries, heart, brain, kidneys, and eyes. In this video, based on real medical research, clinical guidelines, and long-term population studies, you will learn what blood pressure really is, why it rises in modern life, how it silently damages each organ, and the most powerful, scientifically proven methods to control it and protect your life. Blood pressure is the continuous mechanical force that your circulating blood exerts on the walls of your arteries. Every single second, your heart pumps blood through more than 100,000 kilometers of blood vessels in your body. It is measured by 2 values: systolic pressure, when the heart contracts; diastolic pressure, when the heart relaxes. Normal healthy blood pressure is around 120/80 millimeters of mercury. But when this pressure rises above normal for years, it creates constant mechanical stress on artery walls. This stress causes micro tears in the vessel lining, inflammation, cholesterol deposition, plaque formation, arterial stiffening. Gradually, soft flexible arteries turn into rigid pipes that can no longer adapt to blood flow. According to large-scale studies published in The Lancet, even a small increase of 10 mmHg in systolic pressure raises the risk of cardiovascular death by more than 20%. This means high blood pressure is not just a number, it is a progressive physical destruction of your vascular system. High blood pressure damages the body in a predictable and devastating order. 1. Heart damage. The heart must pump against higher resistance. Over time, the heart muscle becomes thicker. It loses elasticity. Oxygen demand increases. The pumping efficiency decreases. This leads to heart enlargement, heart failure, sudden cardiac death. 2. Brain damage. High pressure ruptures tiny brain vessels. This causes ischemic stroke, hemorrhagic stroke, memory loss, dementia, paralysis. According to the CDC, nearly 80% of strokes are linked to uncontrolled hypertension. 3. Kidney damage. Kidneys depend on tiny blood filters called glomeruli. High pressure destroys these filters slowly, leading to protein in the urine, chronic kidney failure, dialysis dependency. 4. Eye damage. Retinal vessels rupture. This causes blurry vision, permanent blindness. This entire destruction often happens without pain, silently. You are at significantly higher risk of developing high blood pressure if you have even 2 of these factors: age over 40, obesity, physical inactivity, high salt intake, chronic stress, poor sleep, smoking, alcohol consumption, diabetes, family history. Men develop hypertension earlier than women. However, after menopause, women's risk increases sharply and becomes equal to men. Genetics alone can increase your risk by up to 60%, according to NIH studies, but lifestyle can override genetic risk if controlled early. More than 50% of people measure blood pressure incorrectly at home. The most common mistakes: measuring immediately after walking, talking during measurement, sitting with crossed legs, holding the cuff too low or too high, using incorrect cuff size. To obtain a medically accurate measurement, sit quietly for 5 minutes. Keep your back supported. Place your arm at heart level. Do not talk. Take 2 measurements. Average the results. Home blood pressure monitoring is now considered the gold standard by cardiology associations worldwide. Salt, or sodium, is one of the strongest and fastest triggers of high blood pressure in the human body. According to the World Health Organization, a healthy adult should consume no more than 5 grams of salt per day, but the average American consumes 8 to 10 grams daily, sometimes even more, without realizing it. The danger is not only in table salt, but in hidden sodium inside bread, fast food, processed meat, canned soups, sauces, cheese, snacks. Excess sodium pulls water into the bloodstream. This increases blood volume, pressure inside arteries, workload on the heart. Clinical trials clearly show Reducing daily salt intake can lower systolic blood pressure by 5 to 10 mmHg
So smoking,
naturally, without
decreased physical
medication.
activity,
This reduction
a
alone can
diet
lower the
high
risk
in
of
fat,
stroke by up to 23%, heart attack by up to 17%. Salt is not poison, but excess salt slowly poisons your arteries. Excess body fat is not just a cosmetic issue, it is a metabolic organ that releases inflammatory hormones, insulin resistance factors, stress hormones. All of these directly raise blood pressure. Scientific evidence shows losing just 5 to 10% of body weight can reduce systolic pressure by 10 to 15 mmHg, diastolic pressure by 5 to 10 mmHg. Physical activity works like natural medicine. Just 30 minutes of fast walking per day improves blood vessel elasticity, lowers resting heart rate, improves insulin sensitivity, reduces stress hormones. The American College of Cardiology confirms regular physical activity reduces the risk of hypertension by up to 40%. Movement is not optional. Movement is a medical necessity for your arteries. Lifestyle changes are powerful, but not always enough. If after salt reduction, weight loss, regular exercise, blood pressure remains above 140/90, doctors begin medication. The main classes of blood pressure drugs include ACE inhibitors, protect the heart and kidneys, ARBs, relax blood vessels, diuretics, remove excess fluid, calcium channel blockers, reduce vessel tension. More than 60% of patients require 2 or more medications for full control. Important medical truth: blood pressure medication is not a failure. It is protection for your brain, heart, and kidneys. Stopping medication suddenly can cause rebound hypertension, trigger stroke, cause heart attack. Medication saves lives when used correctly. This patient was 52 years old. His blood pressure was consistently 170/105. He felt fine. He ignored warnings. Then one morning, his left arm became weak. His speech became slurred. He collapsed. It was a stroke. After emergency treatment and 1 year of strict diet, daily walking, correct medication, his blood pressure stabilized at 124/78. He survived, but with permanent memory damage. High blood pressure does not warn. It attacks suddenly after years of silence. High blood pressure does not cause pain. It does not scream. It does not warn, but it kills more people every year than cancer, diabetes, accidents combined. Your heart depends on pressure control. Your brain depends on it. Your kidneys depend on it. Your eyesight depends on it. Check your blood pressure regularly. Control your salt. Move your body. Follow medical advice. Hypertension is silent, but your actions must be loud. Your life depends on the decisions you make today.